Hello, and welcome to a lecture on physical injuries. It's a short one, but important. We'll talk about major different types of traumas. Let's get right to it. All right, so trauma, first of all, is going to be injury caused by extrinsic forces, usually violence or some kind of accidents, as opposed to intrinsic forces, so cancer or coagulopathies or heart attacks, things like that. So trauma, some kind of external forces causing potentially life-threatening or painful injury upon you. And you can put them into mechanical, obvious, or thermal or radiation types of physical injury. And we'll hit them one after another. The US, fourth leading cause of death, and it's the most common in the younger age group. As you get older, of course, cancers and heart attacks will take over as being most important, but early on, various kinds of trauma are the way that you're going to die. Otherwise, disease and such usually comes about later in life. So, common fatal traumatic injuries, automobile accidents, way up there. Alcohol involved in a lot of these fatal accidents too. Falls, you're going to see, becomes really important in the elderly too. And talk about what is fatal, because you could have a broken hip and it could cause just a long-term downhill deterioration of a really elderly person. You know, that being not moving causes pneumonia, et cetera, et cetera. But right away, you think about it could be spinal injuries or things like that. Yeah, suffocation, drowning, and burns too. Yeah. So look at those serious physical injuries. And of course, what is most important depends really on your age group and your sex and race. Everything puts the statistics. It differs then because you're going to have different risk factors depending on how you live your life. Pediatrics, suffocation and drowning, definitely. Yeah. And young adults, you go to they start driving and firearms. Yeah. And older adults, falls jumps in there too. So yeah, so it just kind of depends what part of your life you're in and how you live your life, or what your risks are for a death by traumatic injury. And then, of course, it can be accidental, these things, or suicide, killing yourself, or homicide, someone killing you, or you killing someone, and then undetermined. It's not always clear determination there, whether it's accident or suicidal. Mm-hmm. But when you look at these, it's not homicides, it's going to be accidental deaths. And again, if car crashes are up there, most of those accidental. All right, let's talk about wounds caused by physical injury. So we'll talk about contusions, abrasions. These are familiar to you guys. A laceration, incision, which sounds similar. Both can be done, with a knife there, and puncture wounds. So a contusion, a bruising, and you'll see what it is damage, but you haven't broken the skin, but a big bruise or hematoma usually follows. And the hematoma, you'll see, it changes colors. It goes from red to purples to greens and yellows. And what's causing that is the breakdown of the red blood cells and those pigments, biliverdin, bilirubin. So you have a changing of the colors. And so in this particular, actually it looks like it has an autopsy, because you can see this person didn't die because of these contusions, but they survived. There was time for the colors to change. An abrasion, is not going to be full thickness of your skin, but you guys, you fall on pavement and you cause damage to the top layers of the skin. It gets crusty, and then it usually heals pretty well. So a laceration is a tear in the skin, and so it's usually rough edged, as opposed to a stabbing with a sharp instrument. So a laceration, if you have blunt force trauma hard enough, it'll split the skin, especially in the skull. And you look in here, you'll see you can't, I'll show you this next picture here. Yeah, you can see this, they're called bridging. Because it's a laceration, it's not a cutting with an instrument, it's going to open up and you're going to see coming across of the nerves and arteries. Those are the things that will kind of stick. They're the strongest. And so you'll see a little bit of that. Yeah, sharp force injuries. So incisions, yeah. You can see usually sharp edges, yeah. And then stab wounds, indeed. They can seem pretty small on the outside, but their depth would be greater than that width, depending on the instrument used to stab. And then missile wounds. I mean, you could talk about crossbows or arrows, but more than anything, you're talking about bullets, right? So I'm going to say gun violence is in the U.S. is way above any other country. We've got more guns per person than in just a few other countries, but it's pretty amazing. And so the gun violence is a great cause of death in the U.S. especially. And depends the amount of damage is done. You can have a shot in the skull, and you can have the bones can cause a lot of damage. But as a bullet, a projectile, like a metal projectile, enters your body, it then expands. So often the entrance wound will be the diameter of the bullet, and then the exit wound can be expansive. If the bullet has expanded inside, it can break up into pieces. So yeah, looking at entry wounds, you can see here even a 45 caliber, and you can see the exit wound, tremendous, because and it depends on the type of bullet, how much it expands. There's a lot of variables here, but when you look at a person looking for entrance and exit wounds, the entrance wound will be the smaller one, and so it's the bullet will have expanded if there is an exit wound at all. Sometimes the bullet stays within the body. So large, slowly moving missiles do not penetrate quite as much. But small, high velocity, you'll see so a high-powered rifle, you're just not going to survive that versus a smaller caliber bullet, because yes, the square of its velocity is the amount of injury. So you take the speed and you square it, so you can tell as you go up, it's not linear, but it makes more and more damage the faster the bullet is going. Some pictures here. Perforating is going to have an entrance and an exit wound. Penetrating is, you're not going to see the exit wound. And in this example, you can even see the bullet stop just before it left there. Sometimes it hits bone and it stops, or like I say, if it's a low caliber bullet, it may not have the energy to go all the way through. This is an example of a shotgun with shot. You can have slugs too, but that looks painful, doesn't it? All those little BBs they got to dig out. When you look at entrance wounds, I'll show you a few more pictures though, but you'll see it's going to enter, and you often see kind of a little collar around it. As the bullet goes in the beginning, it's going very, very fast, but it's going to push in the skin before it tears, and it's going to cause a particular kind of real circular bullet wound look. And the exit can be more slit-like or star-shaped. There's a lot of variability. It's not a forensic biology course, but we're just getting y'all should know the basics here. And so they can tell when you look at this wound, was it the gun against your head, or was it in close range, or was it further range? And you can't tell whether it's 10 feet or 100 feet, but you can tell if it's the muscle is right against the skin or a few feet away. And it depends on the length of the barrel. Is how much you can actually see the stippling, these powder burns, all right? So the rifle, you can be a little further apart, and it carries that gunshot residue further than a handgun. But when you look at contact, you can tell, because there'll be sometimes burn marks or pressure marks, or here's some soot deposition. So when the bullet leaves the barrel, the gunpowder had ignited, and it's pushing it through with the compressed air, but behind it comes all this, the burning remnants of the gunpowder. And so you'll see that it tells you, oh, this was a contact. They had the gun to the person's body. And intermediate range, again, depends on the length of the barrel, but you'll see the stippling. That means that the gunpowder still had enough force to reach the body, and it caused these burns and stippling look. Yep. And if you don't see this, then it's called indeterminate, meaning we can't tell how far away, but we know it wasn't close. All right, this is from your book. You can see, looking at that kind of a muzzle stamp, that you can tell this was pressed against the body. All right, abdominal injuries. And this can happen with no apparent external issues. If you get imagine in a car accident, or you fall off a horse and you just hit it really hard, your abdomen, you may look at it, it looks okay, but there can be some serious damage with it. So they always, take it very seriously when they ask, how fast are you going? And if you were going fast, even though you say you're fine, they want to observe you, they want to take a look, because internal bleeding could kill you, and it could take half an hour, hours later, all right? So any significant blow to the abdomen, they worry about internal hemorrhaging. Yeah, sure, your spleen can rupture, definitely. So internal injuries, always an issue. They want to do some scans, as I say, poke around in there. Usually that's not necessary to do exploratory surgery, but they'll take a look and make sure that you don't have any organs bleeding. Ones that organs have a particular issue are fluid-filled organs, and if the force of being hit can cause those to burst. So the bladder comes to mind. Here's that they're suturing up a burst bladder because of some trauma. Or uterus too can blow if you're hit very hard, like in a car accident. Sometimes if you're stabbed in the abdomen, because they're all slippery in there, they can move out of the way because everything can move, and so you'll be okay. But if it actually nicks a part of the bowel, small, large intestine, then you can get peritonitis, where you get that spillage of that bacteria into your sterile peritoneal cavity, which, much like a burst appendix, is life-threatening. All right, chest injury, also a big issue in car accidents when you hit that steering wheel. Most dangerously, the crushing chest injury, is the heart or your aorta bursts, and then bleeding happens so quickly that death is going to ensue. And then another thing often happens is you have rib fractures, and the ends of ribs, when they fracture, are sharp, and so they can lacerate the lung and cause bleeding. You have hemothorax, blood fills up the pleural cavity, and you can't breathe, and you have a collapsed lung, atelectasis. Obstruction of the airways, and it could be blood or other fluid in that pleural cavity, not allowing you to expand your lungs. Yeah. And if there is a blockage, because of some kind of injury, they can do a tracheostomy, and they can go in and they can suck out fluid out of your respiratory tract too if they need to, or just put a tube in so you can breathe. And of course, any kind of open wound, a stab wound in the chest, you're going to have a collapsed lung on that side. And so you need to make a seal, suck out the air, and then seal it up so that you can have a suction again. This flail chest happens when you have a bunch of rib fractures on one side. And what happens as you breathe, you can't breathe properly. And it's going to, let's see, when you breathe in and out, let's take a look. So inspiration, it's gonna come in, and then expiration is gonna, so it's moving. And if it's open at all, the air is gonna come in and out of that injury. So flail chest is when you have a bunch of ribs broken on one side, and it's moving when it shouldn't. It should all be a solid cage. Of course, spinal injuries, a huge, huge worry. Spinal injury, again, car accidents, falls, and depending on where the injury is and how serious it is, if it happens high up, you're going to be a quadriplegic. It's called tetraplegia too. Remember, it's just all four limbs. If it happens somewhere in this middle region, it can be a paraplegic. Just the lower limbs are paralyzed. And at this time, we don't have cures for this. Nerves are difficult to heal, although they can. So when there is spinal cord damage, there's usually inflammation, scar tissue forms, and the connections are lost. And if you think about how the wiring is in your spinal cord, how many axons, microscopic, they're needed for motor and sensory, you can see how damage there would cut off all that information flow up and down. Yep. So depending on the level is going to tell you paraplegia, 2 limbs, quadriplegia, all 4 limbs are, you've lost motor and sensory. And if that was to happen to you, of course, your lifespan is cut down because there's all kinds of issues not being able to move around. And of course, ulcers from bed sores, not being able to move, the nerves to the bladder, you usually lose that control. So you can have kidneys failing. You're just not going to breathe, and without breathing and the less moving, the more chance of pneumonia. So, complications of a spinal injury go beyond lack of being able to use your muscles. And a head injury too. The issue is besides your brain, so many important functions, is that it's in the skull. And what you often usually get is that if there's any edema or hemorrhaging, you have intracranial pressure increases, and your brain will be squeezed out, try to go through the foramen magnum and hemorrhage. And so that's the real issue. When they look at head injuries, they worry about swelling of the brain, subdural hematoma, remember that? So they need to look at that pressure and possibly put some burr holes in there to release it. Burns, we'll talk about burns. And again, everyone has burned themselves, I assume, something. And your skin, minor burns, the skin will cause death locally. But whenever you talk about burns, as long as you haven't gone all the way through the dermis and into the hypodermis, it can regenerate. And your hair and sweat glands, which are actually part of your epidermis, they dive deep into your dermis and down into your hypodermis. And so if you remove the top, those cells that are lining the hair follicles and the glands, they're the epithelial cells that can regenerate your skin. Now, if you've removed all of that, your skin will never regenerate. They'll have scar tissue, and they'll do grafts. They'll take little pieces of skin from elsewhere. If they cut off a small, postage stamp size one and put it here, it'll start regenerating, and then you'll heal this one because it's not too big either. Yeah. So normally burns can heal fine as long as they're not too deep, but we're depending, first, second, third degree burn we'll talk about right now, and your survival depends on what percentage of your body is burned. I mean, if you come to the hospital with 60% of your body, third degree burn, your chance of survival is very slim. You're put into burn units and they try skin grafts, but you lose so much water and the ability to fight infection. And yeah, it's really bad. So first degree burns, you've all got bad sunburn, something like that. It's going to be red, painful, and dry. But you may peel and it'll regenerate. Second degree, think about it going into the dermis. And this is often to be red and moist, blistery and wet. So there's a big difference there, second degree burn. There's deeper, it's going to be moist, not just dry. And again, that can heal as well, no problem. But a third degree burn goes through the epidermis and the dermis, and you got nothing left, stem cells to regrow your epidermis. Yeah, and this is charred and dry, although it'll be weeping and such. But yeah, here's some examples. Take a look at that. It's hard to watch because of the pain involved as well. Although where your skin is actually burned off, you destroy the pain receptors, but in the margins, and yeah, you need a lot of pain meds. Yep, and you can have, of course, extensive scarring because you can't make skin, you'll make a collagen scar. So the major complications of extensive burns are, like I mentioned, fluid loss, infection. Yeah. And that infection you get in your skin can easily travel in the bloodstream and become systemic and deadly really quickly. So severe burns, you need to be in a sterile location. Your wounds need to be debrided, cleaned out, and you need to look at skin grafts, a long process. So take your skin for granted. Don't take it for granted because you can see how important it is. All right, electrical burns, dealing with electricity going through your body. And if I don't have time to talk about the physics of it, but you need to be grounded, right? So if you're wearing rubber boots, or you don't have that connection, but if you're on a wet surface, the electricity will go through you. And going through you is not where the problem is. When it hits the resistance, then it's going to do a lot of damage. So anyway, electrical burns, especially entry and exit sites. So it's going through your body, not causing damage as long as it's the moisture just carries the electricity through, but then it hits resistance, it causes all kinds of damage. And I mentioned electricity too. I mean, besides the burns, I mean, often people hit by lightning, it's going to cause cardiac arrest because the electrical activity of the heart is going to be a little bit shocked by all that voltage going through you. So yes, so the amount of electrical energy, talking about volts and amperage and how much is flowing through it, and the electrical resistance in your tissue, whether if it's moist and flowing through, let it flow through, but once it hits resistance, it's going to cause burns as it pushes through. All right, so done with burns. So we'll talk about heat and cold, excessive heat and cold. So too much heat exposure. You'll see this in long distance runners, or people, military, or people working outside, and if they don't have access to water, and you can have serious heat stroke issues, right? So at first you'll have excessive sweating, and that is how we cool ourselves. We get moisture on our skin that evaporates, will flush our skin with blood, will vasodilate our skin, and it'll carry heat away. It's very powerful evaporation. But continued sweating, you're going to become dehydrated, and that'll cause your blood pressure to go down. You get rapid, weak pulse, and can lead to shock if you lose too much of your water. And then if you come to a point where you're still hot, but you stop sweating, that's a real issue, because that means you're probably looking at heat stroke. Heat stroke is when your body has to decide that water, do I use it to cool off, or do I use it to keep my blood pressure? And if it does that, your temperature is going to skyrocket. And this rising temperature, once it gets above 104, 105, you start denaturing proteins irreversibly. So you'll see, we can actually cool people way down. There's kids that have been stuck under the ice and their body temperatures in the 70s and 80s, and they'll be able to come back from that, by heating them up. But once you get too hot, you have that fever, you've denatured or ruined the proteins, the enzymes, everything you need. It's like frying an egg, and then you can't go back from that. So frostbite, we're here in Maine, it could be an issue. If we're teaching this in Florida, it'd be hard for them to relate. But it's caused a necrosis of the tissue by freezing. And we do this on purpose. If you want to remove a mole or something like that, we'll put liquid nitrogen, freeze it, it'll turn black, and then it will fall off. And so you'll have new skin will grow underneath it. So exposed parts, it's usually on your toes, but it could be nose, ears, exposed to cold. And you can see here, looking at more and more serious destruction. And you get to the point where the tissue is no longer viable, you've killed it, and then you can have gangrene, you can have osteomyelitis, it can spread. They're going to amputate. Once you've killed this tissue, you've frozen it, it's not going to come back. So, yep, you'd much rather lose some toes than let it spread and lose your life. Okay, hypothermia is excessive exposure to cold. It's going to bring your body temperature down. And once it comes down too low, you're on your way to death. When you hit the first feelings of hypothermia, it can be confusion. And obviously, you're shivering and you're cold. And then, you'll see, mentally you start deteriorating. In water, it's even more rapid. And so if you, a serious person spends time out in the cold ocean, you probably have an immersion suit, which allows you to survive much longer in the water, hours and hours longer. Because water really sucks the heat away. And so, yeah, cold water will make you hypothermic much quicker than in cold air. And we can induce hypothermia on purpose. We do this, you're gonna have a heart surgery, brain surgery, we can lower your body temperature purposely because you use less oxygen, and you can survive longer. All right, solar radiation. Oh my God. It's sunny out right now. I can get a little bit of sun. I know, very mixed signals about, oh, you need sun for vitamin D. And then I tell you, yeah, all the skin cancers. So obviously, you need some sunlight to activate vitamin D, but you get too much, and the UV radiation destroys, really looking at the nuclei of the basal cell layer of your epidermis. And your body will react by making melanin, by tanning, to try to protect yourself, but that takes time. And yeah, actually, when we did the skin, you saw this chronic exposure gives you, deteriorates the elastic and the collagen. So you see skin in older people that has been damaged by the sun. And of course, we talk about skin lesions and skin cancers. We talked a lot about that in the earlier lecture. All right, now UV radiation is at a certain wavelength. We go at even smaller wavelength. We're talking about X-rays, all right? And they can pack more of a punch and cause a lot of damage, radiation, right? So what we're talking about here is it's going to influence cells that are dividing, the nucleus is dividing. So important concept here is, where does a radiation, where does it affect you in your body most? Well, rapidly dividing cells, because they're the ones where the nuclear material is important. And if you destroy that, that's where you're going to see it. So you see it in the bone marrow, where you're making blood cells constantly, right, every single day. Intestinal epithelium and your skin. And then testes, you're always making a new sperm all the time, and your skin. So yeah, skin, gut, bone marrow, really affected by radiation. So you can think about what kind of symptoms you would have, right? Skin issues, leukemias, blood issues, right? So here is radiation affecting the DNA, causing, a possible cancerous lesion. And then you can see different types of radiation. We won't get into it, but you can see, the most powerful. We wear lead shields because it blocks just about everything. And nuclear power plants have lead and concrete to help stop that radiation. All right, what does it do to you? Of course, changes in your connective tissue, your vascular, and even, you'll see, people that are exposed to radiation, it causes these long-term effects too. Yeah, you can talk about things that happen years later. We know, unfortunately, a lot about this from we ended World War II by dropping nuclear bombs on Hiroshima and Nagasaki, and then big nuclear power plant disasters, Chernobyl in Russia, and then Japan just had one. And you can map the people close by are killed instantly. And then as you go even miles out, depends on your exposure to radiation, the amount is what kind of damage it's going to do. And what about getting x-rays when you get your your teeth cleaned, things like that? Well, we think that our x-ray, the amount we give is not causing neoplasms and cancers. We feel like it's at a low enough level, and we give it not enough that it's worth it to get that chest x-ray, that tooth x-ray, because you're taking a risk getting that radiation, right? I talked just recently, the endocrine system, one of your glands is particularly sensitive to radiation. That's your thyroid. Remember that little collar you wear? All right. So we actually give radiation to kill cancers. And definitely, so this shows a machine here. It's going over the breast. You can see that kind of radiation. Sometimes in prostate cancer, we'll put radioactive tablets in a syringe, and we'll just push them right where they belong, like that. Or we'll give you radioactive iodine as a drink, and it ends up in your thyroid, and that radiation will kill the nearby cells. So we use radiation as therapy in cancers or in killing overactive cells, because that radiation will kill those cells. But you got to just know where you're putting it, right? You don't want to kill healthy cells. You got to put it in areas where it can do its job. So we think diagnostic x-rays, limited damage, right? But they keep track of that, right? We don't have home x-ray machines that people use. And when they first invented the x-ray, those people all got cancer because they didn't realize the danger, okay? And then environmental radiation, we just don't know a lot about the long-term effects. If you live by nuclear power plants, or we look at Chernobyl. I mean, still people can't live miles around because the fallout from that, the radiation, the half-life is hundreds of years. And so it'll be uninhabitable unless we spend billions going in and cleaning it up. But you're always exposed to some radiation from the cosmic rays. You always are. And it's what caused mutations, which are helpful in evolution too, but they can be harmful. Usually they are harmful. Yeah. So yes, here's the fallout from that nuclear power plant in Japan. We could measure radiation globally. So yeah, the Chernobyl, it spread all across Russia and Europe. So yeah, we won't get into talk about this. Nuclear power is clean. You only have water, except you have really bad waste, all right? But it's not burning coal and oil is increasing CO2 levels. So yeah, we don't have the perfect energy source yet. But radiation poisoning, we know quite a bit about it. You can see over a long period of time hair loss, because if you irradiate those cells that are rapidly dividing, include your skin cells and your hair loss, anemias because the bone marrow, you're affecting that definitely. Gastrointestinal, we talked about the gut. Yeah, so these are all rapidly dividing tissues, especially are going to be influenced, like leukemia from bone marrow issue. All right, so yeah, we covered physical trauma, we covered burns, heat, and cold radiation. So yeah, a little bit different than a lot of the chapters looking at specific diseases, but hope you enjoyed.